Hi, my name is Miwa Geiger. I am the director of the Fetal Heart Program at Mount Sinai Kravis Children's Heart Center. So this program's been in existence for quite a while, before I started about 13 years ago, but it's really taken off and developed to be um, a program that I'm very proud of. I think one of the most important things about our program is that we have so many talented fetal cardiologists, pediatric cardiologists who have done extra training, most of us in fetal cardiology. So there's 7 pediatric cardiologists that can see patients. And we see patients pretty much within 24 hours of there being any suspicion of a congenital heart defect. So this year we've created more of a collaborative clinic or visit for patients who specifically are coming to transfer their care because they're carrying a fetus with a congenital heart defect. So some of these patients were originally planning on delivering at a more community hospital where there is no cardiac surgery. And so once they're transferring into our program, we really want to provide collaborative care and care for the family as well. So we have started a program where we evaluate the fetus for its congenital heart defect, and then also get them in the system with our obstetricians and high-risk maternal fetal medicine specialists, so they can help manage the delivery. And we make together a plan for the patient and for us to best optimize the delivery outcome with the MFM team. In addition, once we figured out the diagnosis and made a delivery plan, we also involved the neonatologists, the cardiothoracic surgeons, as well as social workers to participate in this planning and to also let the families meet the people that will be taking care of their baby after birth. Well, I think one of the unique things about our program is that we have so many different cardiologists that really care about the patients, and I'm very confident in my colleagues' ability to make a family feel comfortable with the diagnosis and explain sometimes quite complex physiology to families. And over a period of time of getting to know them, the family comes to trust that cardiologist. So I'm really proud of the way our team works in educating families and working with the other subspecialists. And we're not really a factory. We kind of treat each patient as its own. So even though a diagnosis may be similar, there are nuances that are a little different to each patient. And we really try to accommodate those things while keeping in mind that the family is quite anxious around a diagnosis of congenital heart disease. So trying as much as possible to make things go as smoothly as possible around the delivery. We have some really dedicated pediatric cardiologists, and I'm very proud of my team. We're also almost always available. As many referring physicians know, I'm almost always available on my cell phone, but we are usually able to see a patient the day that something is suspected. So there's not a lot of anxiety for the patient waiting a couple of days or even a week to find out what's wrong with the baby's heart. We will see the patients within a few hours, at most 24 hours, and be able to provide counseling and prognosis for that patient.